Welcome to our Facebook Live session about COVID and blood cancer. I'm your host, Claire Saxton, Vice President of Education and Outreach at the Cancer Support Community. Before we get to specifics about COVID and blood cancer, I want to take a quick minute to introduce the Cancer Support Community and a few of the many services that we offer to cancer patients and their loved ones who might not know all we do. Cancer Support Community is the largest professionally led nonprofit network of cancer support worldwide. We offer the highest quality social and emotional support online, over the phone, and through our local cancer support communities and Gildas clubs across the US and in 3 other countries. For more than 35 years, we at the Cancer Support Community have been a relentless ally for anyone impacted by cancer. We help individuals manage the realities of this disruptive disease, whether accessing our free services in person at one of our 175 locations, online, or over our toll-free helpline. You're getting a team of licensed professionals providing patient navigation, financial counseling, genetic counseling, pediatric support, and more. On this next slide, you can see some of the support and information resources we provide at the Cancer Support Community. The first one there is the Cancer Support Helpline, which is staffed by licensed professional counselors and trained advocates who are available to assist you Monday through Friday, 9 a.m. to 9 p.m. Eastern, and Saturdays and Sundays from 9 a.m. to 5 p.m. Eastern. Through the helpline, you can ask to participate in our Open to Options program, which is a research-proven program to help you understand any shared treatment decisions by preparing a list of questions to ask your healthcare team to answer. Later in this Facebook Live, I'll talk more about how else Cancer Support Community can help and inform you as you live with cancer. But right now, I'd like to introduce you to today's speaker, Dr. Saad Usmani. Dr. Usmani is a specialist in hematology, medical oncology, and bone marrow transplantation. He joined Levine Cancer Institute in Charlotte, North Carolina as the director of their plasma cell disorder program, and is also the director of clinical research in hematologic malignancies at Levine Cancer Institute, Carolina's healthcare system. Dr. Usmani is also a clinical professor of medicine at the University of North Carolina, Chapel Hill School of Medicine. Dr. Usmani is board certified in internal medicine, medical oncology, and hematology, and is a fellow of the American College of Physicians. He holds membership in several professional societies, including the International Myeloma Working Group, the SWOG Myeloma Committee, the American Society of Hematology, the American Society of Clinical Oncology, and the American Society of Bone Marrow Transplantation. So as you might be able to tell from what I've said, he's very active in clinical research and translational research, and his research interests include a focus on plasma cell disorders, in particular high-risk multiple myeloma. And Dr. Usmani is going to help us better understand today's topic of COVID and blood cancer. So welcome, Dr. Usmani. Thank you for joining us.
Thank you so much for having me here and getting me involved in this dialogue.
And we are very happy to have you here. So we know that when COVID first started, the first impact was to people's treatment. Treatments got delayed. Many people, when it was possible, got moved from IV treatment to oral treatment. And we also know that patients were very anxious about being immunocompromised and how to stay safe during the pandemic. So what measures have blood cancer centers put into place to keep patients safe during COVID, now that we're a year in?
I think we have come a long way in this past year, or a little over a year now, actually. The first case that was recognized in the United States was towards the end of January of 2020 out in Washington State, in Seattle. And then since then, I think that was just the first diagnosis. It was clear later on that COVID had already spread to a lot of urban and suburban areas. Northeast got hit afterwards. The challenges we had at that time during the pandemic were uh, uh, figuring out the best way to help diagnose patients. So having reliable PCR testing that can diagnose patients was the first step. The second step was getting SOPs in place to ensure that we are trying to prevent the spread of the infection. So common sense measures like masking, social distancing were heavily promoted within the patient population, and these are not ideas that are foreign to hematologic malignancy patients. Blood cancer patients, know that their immune systems are low and are used to being watchful, to prevent infections. The cancer centers created a lot of SOPs around who can come into the cancer center, and when they're coming in, everyone needs to be screened. So screening checkpoints are always placed, and this is true not just for cancer centers, but all healthcare systems through infection prevention and control efforts. So screening employees as well as everyone who's coming in for symptoms, and you either get a green pass to come into the building, or you go home and quarantine if you're having any symptoms, and then get tested. That was the first step. The second important step was limiting visitors, which was probably the hardest thing to do, because our patients rely heavily on their support structure to carry them through this. This is a very difficult disruptive disease, as you mentioned, and we rely on each other. The cancer care providers and our teams in the hospitals and cancer centers are only part of the support structure. That there's a lot of support, social support required to see our patients through in this journey, right? So not having them posed a challenge, but it was a necessary step to ensure that we are not introducing variables that we cannot control. And that was, I think, a difficult but necessary part. So whether patients are coming in to see us for the first time, hearing about their diagnosis, they did not have their loved ones sitting right next to them. They were on the face, they were on FaceTime or on the phone, but not coming in. So that, even though it's a step towards preventing infection, it posed a lot of challenges for our patients in general. And during this time, we got better with availability of the PCR testing. We had asymptomatic testing introduced at our center. So for patients who are getting chemotherapy, they have to be COVID PCR negative before they start their next cycle of treatment, so that if we do detect asymptomatic disease, we are not making them further immunocompromised by giving them potential treatments that can do that. Um, so some of the all of these measures helped in reducing the likelihood of patients getting COVID within the healthcare setting. I honestly thought that the healthcare setting was probably the safest place, knowing what has happened in the past year, compared to going to a grocery store, or going out somewhere to take care of your daily needs. Sorry about the long answer, but I thought that I'd give a broader perspective here.
Absolutely. And so, how do you see COVID impacting treatment options, schedules, visitors now? Has that changed over time?
Certainly, it has changed. We have been able to return to some sort of normalcy from that perspective. There's also a bit of acceptance that from our patients that we have to adapt to the current environment. I have to say that the early fear of the unknown is kind of waned over time. Most you still have to, yes, you're worried about COVID-19 or getting that viral infection, but you still have to worry about your disease first. So during the surge months, when cases were surging, um, we had to reduce the volumes of patients coming in and space out the infusion appointments or switch to oral medicines. But 6 or 8 months later, we had better capacity and SOPs in place to make sure that our patients are getting, the best standard of care treatment possible. So I think we did learn a lot of lessons from that early surge, and we were better prepared because we had these asymptomatic screening guidelines in place.
So let's talk a little bit about, particularly for people living with blood cancer, if they're in active treatment, do they have a higher risk of getting COVID or of getting more severe COVID? I mean, many patients, and certainly not all blood cancer patients, but many blood cancer patients are told that they are immunosuppressed or they need to take extra precautions after particular kinds of treatment. But what does both having the cancer and having the treatment do in terms of their risk?
The data that we've so I will uh, start off by saying all we know about COVID-19 and effects in cancer patients as well as the general public, all that information is only about 16 or 17 months old, right? So you have to keep that in perspective. But what we know so far is overall patients with any cancer have a higher chance of getting the infection or symptomatic infection and having more severe symptoms requiring hospitalization or even a stay in the ICU. Within cancer patients, the risk is highest for blood cancer patients of either getting symptomatic disease or symptomatic disease that is severe enough for them to be in the hospital or even in the ICU. And thirdly, the risk of dying from this infection is perhaps the highest in cancer and then blood cancer patients as well. And these are data that have been published from the European experience, as well as the early experience that we saw from the Northeast United States, data from the New York and Boston area. And then cumulatively, I think there were efforts through several um, registries that documented through ASH as well as the NCI CCC that documented this higher likelihood of patients developing severe infection requiring ICU stays, or even the higher likelihood of dying from COVID if they get it. So this risk is real, and it's the same for any other infection as well, right? And this is a very contagious kind of an infection, spreads, it's spread quite fast. So it's not any different compared to the other infections.
And so are there, if they are at higher risk, are there additional steps that people living with blood cancer should be taking on a regular basis? Are there additional steps that people who live with them should be taking?
This past year has been exhausting for the general public, or I should say the global population in general. But blood cancer patients, I have to say, have been generally used to taking care of themselves, socially distancing themselves, washing their hands. I think the big introduction here, and again for our stem cell transplant patients, wearing masks during those 100 days initially is something that they were already used to. It's just that they had to extend that beyond the 100 days and keep on doing it. There is some element of fatigue associated with that, but for the most part, I think the blood cancer patients have done a really good job with that, and that's something that I would say that we continually need to do until we have reached herd immunity in the United States. What's the good news is that we had the first emergency use approval by the FDA for the first COVID-19 vaccines back in December. Now we have three of them, and we have started vaccinating our population in December, and it's expected with more millions of hundreds of millions of doses coming with all three different vaccines. that we'd be able to vaccinate the vast majority of our blood cancer patients before the summer. So that's the third step. Getting vaccinated is going to be that third step.
And so one question actually that we've gotten through Facebook that's relevant right now is this person was asking that they have smoldering myeloma, but what about other blood cancers that where patients are in a watch and wait kind of a situation or in remission? What is their risk for infection with COVID-19? Is there still a heightened risk there?
There's a heightened risk in general. So, for most patients, who've got MGUS or smoldering disease, the plasma cell disorders tend to happen in older age anyway, right? You're not, in your teens or 20s or 30s generally, when you're being diagnosed with these conditions, you're in your, sixth or seventh decade of life. That by itself, older age by itself, is a risk factor for contracting COVID and getting severe symptoms. We already know that, irrespective of having cancer or not. So that your age and other health issues already put you in that group. So even though you may be in remission and your immune system is doing a fantastic job, and in keeping you out of trouble from other infections, you should still be careful, and because of those other factors, and get the vaccine when it's available to you.
And so let's talk a little bit about the safety of the COVID vaccine, especially for people with blood cancers. Are all the COVID vaccines safe for people with blood cancers?
Yeah, so the three that have been approved by EUA and are being utilized to vaccinate the US population, all of them are safe for our cancer patients. The biggest um, or the most common side effect, I should say, people get is that sore arm, that first day that one would generally get with a flu shot anyway. But beyond that, we haven't seen a lot of much in terms of adverse events in that patient population. So two of those vaccines are mRNA platform-based vaccines. They're very safe. The third vaccine, the Janssen vaccine, is what is called a viral vector-based vaccine. So it's not a replicating live virus or something like that. That's also very safe in immune-compromised patients. So all these three vaccines are very safe.
Great. And then are there any patients who are undergoing active treatment for blood cancer who should not get vaccinated?
Um, no, I think the current recommendation is that all eligible patients should be getting vaccinated. I think the only caveat here would be someone who is about to get a stem cell transplant or CAR T cell therapy. If someone is within a month and a half of that intervention, it's better to get the vaccination after they've recovered from their transplant or CAR T cell therapy.
But if they're just been diagnosed or their treatment is other treatment than stem cell transplant and CAR T therapy, they
And that,
should be
yes, they
trying to
should be,
get,
absolutely.
okay. And my, I certainly don't know I don't talk with patients across the country all the time, but I have heard from a number of patients that those who were in active treatment, many were able to get help getting the vaccination through their healthcare team, through the institution they were being seen at. So that was helped make the process less worrying for a lot of the people that I've talked to.
Definitely. I think, what we've seen over the last year again is, the power of social media and how, despite the fact that, the doctors and healthcare providers can't meet, physically meet with each other, it's brought the world very close. And we have been collaborating with not just colleagues around the United States, but all over the world in spreading the word and trying to find innovative ways in which we can, get the right information out and also help facilitate early vaccination for our cancer patients, and advocating it for, at the city, county, and state level to try to get those resources. Because again, we don't have, when the vaccines were coming on, there were only so many doses available, and they were being distributed in a rationed way to different states around the country. So every state had to make a decision. All right, who is going to be the top priority? And our job was to try to, push the envelope for our patients.
And so, what about family members, caregivers, people who live with blood cancer patients? Should they be looking to try to get vaccinated as soon as possible as well?
That's correct. I think, if you meet that criteria, so caregivers of patients with chronic illnesses or immune compromised patients, are eligible to get the vaccine. And we are sitting in the end of March right now. I suspect that in another few weeks, most of the states will be able to allow anyone over the age of 16 to get vaccinated. So, yes, it's important for the caregivers, and those who live in the same houses as blood cancer patients to get vaccinations. I think it will become an easier path for them in the coming weeks.
Great. And uh, one of the questions that we've heard is that there's been some, or one thing that we've heard from patients is that sometimes there's some friction between people that they live with and family members, and how their level of safety in interacting with the patient. That it can sometimes be frustrating to try to be, keeping yourself safe and trying to get vaccines, and making sure that you're masking, and then have other members of your household who aren't keeping those same levels of safety, or maybe because of work are having to be exposed to the public a lot. And is there any indication that either people with blood cancer or survivors or their family members are choosing not to get vaccinated? Are you hearing any patients or caregivers saying, no, this is, I'm afraid of the vaccine and I'm not going to take it?
I'm not hearing that as much from the patients about their own concern, because again, there's a lot of information out there about the severity of this infection with so many millions of lives lost, and the fact that our cancer patients are at a higher chance of getting the severe infections or dying from it. Um, and many of our patients know of someone, who has died from COVID-19 as well. And including people who never had any immunocompromise, right? So that all also puts them in a better informed position about the vaccine. The way that I would try to approach this problem. I know that this past year, especially in the United States, this whole public health issue got polarized politically as well, and people may have different stances on this. But the bottom line is, all of us are human being and we should be caring for each other. There are things that we're part of a big community, and there are things that we do to protect our vulnerable members of our community. And even though I'm not, immune compromised, the reason why I would take the vaccine is because I owe it to the larger community to help protect the most vulnerable folks. So I think making that case is going to be very important. Having those discussions, and again, instead of looking at conspiracy theories, you should hear about the real information and data about the safety of these vaccines, and what they've shown in all these clinical trials with tens of thousands of patients. What they've shown is, for people who didn't get the vaccine, they had a higher chance of getting severe infections or dying from it. For people who got the vaccine, none or very few patients got severe infections, and died. So that's it's all that data is out there. So presenting the information along with the rationale for why we're doing this. And we forget the lessons from history. The vaccines helped us overcome so many difficult infections. People forget how bad polio was back in the day. I'm one of those kids who did get the polio vaccine towards the fag end of that pandemic. But yeah, I mean, there were hundreds and hundreds of people um, who lost the ability to walk, or died because they couldn't breathe because of the polio virus. And as soon as that vaccine was developed, we eradicated that disease, that crippling disease, from our planet. Um, uh, so I think people need to recognize the reason why we're doing this, and why we do vaccinations as a preventative strategy. It's to um, protect the most vulnerable folks we have in our communities.
So I'm getting quite a few questions from our listeners about how protective is the vaccine for people in active treatment. There was some questions about a study out of the UK that said perhaps patients aren't getting antibodies as much as the healthy population from the vaccines. Do we know, is there, number one, do we know how effective, if there's any difference in its effectiveness among blood cancer patients? Um, and then I have quite a few questions about practical things. What can I do? What should I do? But first, how do we know how effective the vaccine is for blood cancer patients?
So first message is, any protection is better than no protection. Okay. The second message is, we do not know the quantity of antibodies one needs to make to have protection from this virus. Okay. We're
Okay.
just learning that in the normal population, and the studies in the cancer population is ongoing. What I can tell you is, the first experience with vaccinations in some of the countries that are starting to vaccinate, very, very quickly, is that the number of cases is going down and the number of deaths of COVID-19 is going down. So, I think, my quick answer to the question, would be, yes, the likelihood of response or antibody response is lower compared to someone who has, who does not have myeloma or is not immune compromised, but that would be the same for the flu vaccine and potentially other vaccines. But the real question is, will you be able to make enough to keep you safe, right? So the answer is probably. And we cannot quantify that right now, but hopefully, by the summer or later this, after the summer, we'll have that information that we can share with our patients.
And so let's say that somebody has blood cancer, has gotten their full vaccination. So if it's one of the vaccines that requires 2 shots 2 weeks after the second shot, or if it's the Johnson & Johnson that just requires 1 shot, what what kind of everyday activity can they go back to? Can they be going to the grocery store? Do they still need to have somebody else be going to the grocery store for them? Can they start seeing people who are also vaccinated? How can blood cancer patients determine how susceptible they might be, even if they've had the vaccine, and how safe they need to be?
All right, so there are two very important pieces to this, right? One is um, still being careful, just like you are in the flu season, right? So hand washing, and something that we weren't doing with flu is masking, right? So wearing the mask, being careful when you go out, it's you have an extra layer of protection with the vaccinations on top of those practices. When would we be able to back off of those and increase our activities to how things were before, is when the vast majority, over 60% of the population in the United States is vaccinated, and the infection positivity rate has come down to 1% or less. So it's, the spread is not that much, and the herd immunity has been built up. So we're going to get there, hopefully this summer. But I think being extra vigilant and careful is still something that I would advocate. As an example, I can share with you that at the beginning of January, going into middle of January, the case positivity rate in the Charlotte area was very high. In North Carolina, it was 1 in 5 people who were being tested were positive. But what we've seen over the last, and we had very busy hospitals, a lot of folks, in the ICU. And over the past 2.5, almost 3 months, we've seen that percentage come down to less than 5%. So we've gone from 1 in 5 positivity to 1 in 20. So it's on the decline, and a big part of that is the vaccine campaigns, the fact that our patients or general population is still being very careful, and so once we get to those points, I think we will get there, where they where our patients can return to normal activities, but we're not there yet, just there yet.
Okay, and a couple more questions from our listeners. One is a multiple myeloma patient who had COVID-19 and wants to know, should they get the vaccine since they've already had the infection?
Yes, it will be a boost to your immune system, and we are recommending patients who've recovered from COVID-19 to get the vaccine as well.
And then just to recap, we have questions about, is it safe to get vaccinated during treatment, or how soon after?
Right now, we're recommending patients to get vaccinated, regardless of where they are in their treatment. Um, um, Typically, our patients would prefer getting their vaccine during the week that they're off of chemotherapy, or a few days after they've received their chemotherapy, and that's fine too. But again, we do not know the effects of the treatments that patients are on, and the response to the COVID-19 vaccine. The only thing that we can glean from is the pre-existing data from smaller studies saying, go ahead and get it. The responses may be dampened, but like I said, any protection is better than no protection.
Okay. And then someone also asked if it would be best to have antibody tests done after vaccination to see how well their immune system has responded and developed antibodies.
So I would say it depends. So if you had an infection, um, COVID-19 infection, the antibody tests available right now measure the antibody, the response to that natural infection. So what they're measuring with that antibody test is something different. If you get, and the mRNA vaccines are focused on the spike protein on the virus. And the antibody tests that are available are not measuring that type of antibody response. So you can get, for an enthusiastic patient who got the vaccination and press their hematologist, oncologist to check the antibody test, would be surprised when the antibody test comes back negative, and saying, oh my God, what happened? I got the vaccine and I got no response. Well, you're measuring the wrong thing in the blood, right? So it's very important to understand what's being measured here. So right now we don't have the antibody test to measure the effects of the vaccine itself. Um, those data are being collected on the patients, tens of thousands of patients who got the vaccine. So eventually we'll have that test available for the general population, but we don't have that. So again, the antibody test that's out there, for the most part, it's measuring the response to the natural infection, not the vaccine. So it's not helpful for our patients in making any meaningful um, conclusions.
So to wrap up our discussion of COVID and blood cancer, we certainly want everybody to keep taking all the safety precautions that they've been taking in terms of masking and social distancing, and getting the vaccine as soon as possible. And what I heard you say was that basically the only people who should wait to get the vaccine is if you're currently or just about to get a stem cell transplant or a CAR T cell therapy.
That's correct.
Great. And then anything else that we should be sure that we are telling folks about COVID and blood cancer?
I think it's going to be important in keeping an open dialogue and communication with your local cancer center, and also seeing the trends of what the COVID-19 pandemic case positivity rates are looking like. Follow local guidelines and recommendations. There are going to be many different ways in which you can get the vaccines available to you. Many of the county and state health department resources are going to be at offer through mass vaccination events. Healthcare systems are doing something similar as well. So there are a lot of different resources through which you can, you can make sure that you're in line to get the vaccination. And yeah, I mean, we're always here to help. Many of us are always on social media as well, and keep on fielding questions from our patients and caregivers. Please continue to use us as a resource.
Great. So I do want to make sure that before we go, I thank our sponsors, GlaxoSmithKline, Sanofi Genzyme, Amgen, Bluebird Bio, Takeda Oncology, Bristol Myers Squibb, and Karyopharm Therapeutics. Without them, we wouldn't be able to have the resources to get this information out to you. I definitely want to thank Dr. Usmani for his time and talking to us and giving us some data, the data that we have, because we don't have all the data that we will 2 years from now, but acting on all the data that we have. And just a reminder to stay safe, get vaccinated as soon as possible, except in the two scenarios of stem cell transplant or CAR T cell therapy. Talk to your doctor about when to get vaccinated if you're doing that or about to do that. And we wish everyone well. Thanks so much. Take care.